Hi dear doctors, welcome to the class of Kidscovery. Myself Dr. Parv and the topic of discussion for today's class is of course pediatric neurology, which we are discussing. So let's understand one by one what is the most important issue practically which we face as pediatricians, and in fact the pediatric neurologists are facing is something which is called as neural tube defects. So I've tried to show some of the neural tube defects. I don't know why my team always puts these kind of bad pictures but then okay, so 1, 2 are very important, so let's understand one by one. So I think you know that there is something which is called as caudal neuropore and there is something which is called as cranial neuropore. Okay, so if you have seen something like this, okay, if you have seen something like this, so this is the this one is actually the cranial neuropores, okay, and this is going to be the caudal neuropore. Okay, so caudal and cranial neuropores are the important neuropores. So if the cranial neuropore is not formed properly, this can cause anencephaly, and if the caudal neuropore is not formed properly, it can cause some, okay, so anencephaly is cranial neuropore issue, and caudal neuropore is not formed, then it can cause what? It can cause a spina bifida, and then you have got open spina bifida. So all these things are going to be there. So what do you mean by neural tube defects? So what are neural tube defects? If there is a failure of neural tube closure during the gestation, it results in a spectrum of CNS malformations. Okay, so spina bifida, so let me discuss one by one. So what do you mean by spina bifida occulta? So remember, if there is failure of closure of dorsal vertebral arch, this is called as spina bifida occulta, and they may show the tuft of hair over the defect site. You know, these things, I mean, I have seen growing up, people used to say he is a Lord Hanuman because he's having the tail with hairs, but it was nothing else, just the spina bifida occulta with the tuft of hairs which is going to be there. Then it can be meningocele also. So meningocele, why? Because of herniation of meninges through the vertebral defect, okay, generally seen in the soft tissue mass. Then something which is called as myelomeningocele, that means herniation of meninges, herniation of the spinal cord through the defect, which is associated with the element signs, paralysis, paresthesia, incontinence and everything. So I will just try and show you. See here, this is spina bifida occulta with the hair tuft. Then I have told you meningocele, that means the meninges are coming outside. Then you have got the spinal nerve also coming outside. So this is something which is called as meningomyelocele. Meningomyelocele. Next is anencephaly. So what is anencephaly? If the cranial neural tube closure is not properly done, that leads to absence of forebrain, absence of meninges, absence of skull, so it is not compatible with the life. Now let me just ask you a beautiful question. I hope that you all are aware that this is the mouth with which the amniotic fluid is actually taken inside, okay, taken inside. So do you think like in the child, if the, okay, so let me just put the question now. So if the child is suffering from anencephaly, what is going to be the condition? Either it is polyhydramnios or it is going to be oligohydramnios. So this is my question and I want you to answer this in the comment section below, because this is a FMGE question as well. This is a Central Institute question, so I am asking you this question. So what are the common risk factors? Why do you think there is improper closure of the neural tube? Sometimes it happens with the use of some anticonvulsants like valproate during pregnancy. It can happen because of folate deficiency. It can happen if the mother is having diabetes, okay. Depending upon the symptoms, it can be mild, like asymptomatic one, just like cosmetic defects are going to be seen in the children, or it can be severe, like delayed motor growth, neurological deficits like this. So what are the characteristic findings? So spina bifida occulta, if it is there, it's going to have tuft of hair. If it is meningocele, of course, it's going to be a cystic swelling. If it is myelomeningocele, there will be element signs, incontinence, paralysis, sensory loss. If it is meningocele, I have told you the meninges are going to come outside from a bony defect. with a fluid filled sac which is covered with the skin. Okay, so these things you have to understand. And myelomeningocele, I think I've told you. So there is nothing special which is written in all these things, so we can just remove them out. So what are the associated conditions with these neural tube closure? So there can be Chiari-2 malformation as well, because of course if the neural tube is not formed properly, what is going to be there? The brain is not formed properly, and there will be herniation of the cerebellar tonsils from the foramen magnum. There can be herniation of brainstem, so Chiari malformation type 2, neurogenic bladder. And yes, of course, hydrocephalus can also occur, because if there is not proper formation, it can, very simple thing which you can understand. From the ventricles, the CSF has to travel into the spinal cord, and if it is not formed properly, if this path is not formed properly, it is not going to enter into the spinal cord, and the ventricles are going to have a lot of amount of CSF, and of course, that causes hydrocephalus. So how will you detect this? Of course, USG and alpha fetoprotein and acetylcholinesterase, these are important to detect. So how we used to remember is this is also A, this is also A, and in fact Anencephaly is also because of the letter A. So these are important things. So what is the treatment? So the treatment is you have to do a surgical repair of the open defects. You can do a CSF shunting also for hydrocephalus which is happening, and of course you can do supportive management also for neurological dysfunction. So how will you prevent this? Of course, if the female is on valproate, please stop it. Okay, so folic acid supplementation is being given, and of course B12 deficiency and B9 deficiency, you have to check and stop the valproate also. And the complications is because there are no meninges, the infections are very much seen in these babies, and of course neurogenic bladder, since it is there, so there will be delayed voiding. So because there is delayed voiding, there is going to be retention of the urine, and since the urine is getting retained, it is responsible for causing the urinary tract infections as well. So this was a small topic but yet very important topic, and I have seen it has been asked in orthopedics also, so I decided to take this topic for discussion. Thank you so much for watching. We'll see you in the next class.